Attention deficit hyperactivity disorder. Attention deficit hyperactivity disorder is a developmental disorder marked by persistent symptoms of inattention and/or hyperactivity and impulsivity that interfere with functioning or development. Attention deficit hyperactivity disorder arises from maldevelopment in brain regions, such as the prefrontal cortex, basal ganglia, and anterior cingulate cortex, which regulate the executive functions necessary for human self-regulation. Symptoms begin in childhood and can affect daily life, including social relationships in school or work performance. Attention deficit hyperactivity disorder is well known among children and teens, but many adults also have the disorder. People with attention deficit hyperactivity disorder experience an ongoing pattern of inattention, having problems staying on task, paying attention, or being organized, which are not due to defiance or a lack of comprehension. Hyperactivity, being extremely restless or constantly moving, including in situations when it is not appropriate, excessively fidgeting or tapping or talking too much. Impulsivity, acting without thinking, interrupting others, or having difficulty with self-control. Impulsivity can also involve a desire for immediate rewards or an inability to delay gratification or consider long-term consequences. A patient with inattention, inability to sit still, and impulsivity are concerning for possible attention deficit hyperactivity disorder. The diagnosis of attention deficit hyperactivity disorder is made clinically and requires evidence of symptoms in more than 2 settings. For example, home, school, after-school program. Demonstration of functional impairment due to symptoms, for example, academic difficulties, impaired social relationships, peer rejection, is also required. Obtaining teacher evaluations to determine if the symptoms extend beyond the home environment would be the most helpful step in establishing the diagnosis. Teachers can provide observations of classroom behavior over an extended period, for example, 6 months, and assist in determining if the symptoms are excessive compared to same-age peers. For example, comparative degree of inattentiveness, difficulty staying seated and/or following directions, talkativeness, disruptive classroom behavior. Teacher evaluations may also incorporate validated attention deficit hyperactivity disorder specific rating scales, which can help assess core symptom severity and monitor response to treatment. Summary of attention deficit hyperactivity disorder. Clinical features. 1. Inattentive and/or hyperactive impulsive symptoms for 6 months. Inattentive symptoms, difficulty focusing, distractible, does not listen or follow instructions, disorganized, forgetful, loses, misplaces objects. Hyperactive impulsive symptoms, fidgety, unable to sit still, driven by a motor, hypertalkative, interrupts, blurts out answers. 2. Several symptoms present before age 12 may persist to adulthood. 3. Symptoms occur in at least 2 settings, for example, home, school, and cause functional impairment. Treatment for attention deficit hyperactivity disorder. Stimulants: methylphenidate, amphetamines. A behavioral therapy. Diagnosis of attention deficit hyperactivity disorder requires evidence of inattentive and/or hyperactive impulsive symptoms for more than 6 months in more than 2 settings. For example, home, school, after-school program. Teacher evaluations can assist in diagnosis.